Hey everybody, I'm Michael Monken, firefighter with the City of Solana Beach.
Hi, I'm Eric Nixon with AMR Ambulance.
Today we're going to give you a quick demonstration of how to do hands-only CPR.
And how to use an AED when someone is having a sudden cardiac arrest. First of all, there's a difference between a heart attack and a cardiac arrest. With a heart attack, someone's experiencing symptoms, right? They have chest pain, they might have pain down their left arm, their skins are going to be cold or sweaty, they're going to be breathing really heavy, they might even lose consciousness. But they're still alive, they still have a pulse, they're still breathing. In that situation, call 911 immediately, have the person sit down or lie down, and stay with them until help arrives.
Meanwhile, in a cardiac arrest, the person has no pulse and is not breathing. This is an urgent medical emergency and requires immediate action. Hands-only CPR is easy to do and can make all the difference between life and death. All right, so now we're gonna walk you through hands-only CPR. So, approach the person, try to wake them up. Hello, 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 are you awake? If they're not awake, go ahead and start compressions and direct someone else to call 911. Make sure to push hard and fast,
Hello, yeah,
about 110 beats per minute.
Breathing. My friend's already doing compressions. And remember, the person needs to be on a hard, flat surface. Help them to the ground, protect their head, start doing compressions hard and fast, about 110 beats per minute.
So now we're gonna go over CPR again, but we're gonna add in an AED to the mix. So, same thing. You see a person, they're down, wake up, are you awake? They're not awake, go ahead, tell a friend, go activate 911, get an AED, come right back and start compressions.
Hello, 911. Yeah, we got a person down, they're not breathing, no pulse. My partner's already doing compressions. I'm gonna put you on
It's very
speakerphone.
important, like I said before, push hard and fast in the center of the chest, about 110 beats per minute.
Okay, all AEDs look a little different, but they all operate exactly the same. All you have to do, turn it on and follow the directions.
Apply pads to patient's bare chest. Plug in pads connector.
Don't stop CPR while the pads are being applied.
Apply the pads, has to be to bare skins. There are little pictures on the pads that show you exactly where to put them, so you don't even have to worry about that. Again, we're not stopping CPR. We've got the pads, following the directions. We're now going to plug this in.
Analyzing heart rhythm.
It's going to analyze the heart rhythm.
Do not touch the patient.
Stay clear, so it just analyzes the patient and not you.
Shock advised.
Okay, it's advising a shock, but it needs to charge
Charging.
first. Get back on the chest.
Stay
Continuous
clear of
compressions are
patient.
very important.
Deliver shock.
All right,
now.
it's charged. I'm going to make sure no one's
Going
touching the
shut
patient. I'm
down.
clear, you're clear.
Clear.
We're going to deliver the shock, and this is a great time
Shock
to switch.
delivered.
I'm going to start doing compressions because CPR is very tiring.
CPR.
I'm going to take over, Mike.
You ready to take over?
Yes, sir.
Ready when you are.
All right, here we go.
On three. 1, 2, 3. So you're going to hear a little beeping. That's not the patient's heartbeat. That's called a metronome. It just tells you the rhythm in which you should compress.
That's right. Now it's going to take you through 2-minute intervals. Compressions, reanalyze, reshock. Keep doing that until help arrives. All right, so just simply follow those easy steps and you can save a life. Mike's going to show you the model that most of you are probably going to be using. It's called the PowerHeart G3 Plus. It's a little bigger because it's a real one. It has a big battery to deliver the shock. Simply take it out of the case, open it up, push that button right there. It's going to turn itself on. It's going to give you voice prompts.
Stay calm. Follow these voice instructions. Make sure 911
It's going to tell you
is called
step
now.
by step what you need to do,
Begin
what
by
you need to
exposing
know.
patient's bare chest
If you
and
can't hear
torso.
for some reason,
Remove
there are
the
also
clothing if
visual prompts. It's that simple.
So this will be open and we're going to
Turn
walk
over the
through
foil
it
package
just like we
across
did
dotted
with
line
the
and
fake
remove
AED we
pads.
showed you earlier in the video.
One of
So
the
you
white
walk
pads
up, you
completely
see somebody,
remove
they're
plastic
unconscious.
cover.
Wake up, wake up.
That
They're not
corner.
waking up. You can go ahead and look, listen, and feel. Do you hear them breathing?
Next,
Anything like
separate one
that?
of the white
You
pads
don't, start
completely
compressions.
remove plastic
Gonna
cover.
go ahead and tell your friend,
Of
hey,
that
go
corner.
call 911, get an AED, and come right back.
Next, separate
And
one
like
of
we
the
went
white
over
pads
earlier,
completely
we are
remove
not going to
plastic
stop
liner.
compressions
Begin
even
peeling
when
from the
we're
tab
applying the
corner.
pads. We're going to push hard and fast at about 110 beats per minute. They're then going to attach the AED, it's going to analyze the rhythm, and then just follow the prompts.
It's that easy. Make sure you're safe, check the patient, call 911, start compressions, and if you have one available, get an AED.
Thanks for listening, everyone. Have a great season.
Play ball!